Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. Before we dive into this powerful episode, please remember to subscribe to our channels and to give us a 5-star rating on iTunes to continue hustling. This episode is sponsored by Imaging Services, Chiro Health USA, Chiro Moguls, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, New Patients in a Box, the Influencer Authority Podcast Training, Mango Voice, Community Healthcare Resources, Life Chiropractic College West, TrackStat, and M-Sculpt. Let's hustle.
Hey guys, welcome to episode 449 of the Chiro Hustle podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we had the opportunity of interviewing Judy Lombard. And if you want to hear the story about how to reduce inflammation through laser care, stay tuned. Welcome back. This is another episode of the Chiro Hustle podcast. It's episode 449. That's our 449th episode. I can believe it, but can you guys believe it? This one we have Judy Lombard coming on, and it's going to be a bit of a different story. It's going to be based around the healing journey of laser. And I think that a lot of people will have some questions, as I do, as to what it helps with. And I was discussing with her pre-interview about the vacancy of touch over the past couple years and how some of the products that she has with Multi Radiance might be able to help with this, specifically the class 1 laser. So, but before we get into her talking about all things that are awesome that she knows, I'll just let you know the big why. Why do we do what we do over here at Chiro Hustle? Well, freedom of speech is imperative. So our show protects freedom of speech, specifically medical freedom of speech. So many times I've heard people get stymied, shadow banned, discredited, and our show does not do that. I was once asked, is there ever a show that you guys had that you didn't air? I said, no, everything I've ever recorded went live, except for bad audio, obviously. But I think that that's a really powerful piece of what we do. And we give people space to talk about what makes them unique in this world. Second thing is we do protect BJ Palmer's Sacred Trust. If you want to know a whole lot more about chiropractic, go to your favorite search engine and look for BJ Palmer's Sacred Trust. He is the developer of chiropractic, and they were his last words. He said, there is a sacred trust and guard it well. And I think that's super powerful. And then we also believe in subluxation chiropractic, which we'll talk a little bit about with your story today, and how the laser can help with inflammation around the subluxation. So many times the body needs a little bit more to heal. And then we believe in innate intelligence and universal intelligence, and that when man or woman, the physical, gets adjusted, it connects them to man or woman, the spiritual, which is some whole next level stuff, because there's a huge disconnect with how we feel and how our body feels. And I know that the laser systems can help with that. So we call this a biohack. I think that people are really curious to know more about lasers. But Judy, I just want to welcome you to our show. And I have a lot of things I'm curious about with the lasers.
Thank you, James, for having me. I'm excited to be here.
So let's talk about the laser systems that you guys have and what they actually do.
Okay, the laser systems that Multi Radiance has. We have a lot of handheld portable units that are, battery operated, so you can take them. They have about 6 to 8 hours of battery life, so you can take them to the sidelines of your game and treat your teammates if you're playing ultimate frisbee and treating a calf cramp after a game, which I've done. Or preventing, working on an issue that someone has that's a longer standing issue, like a strained muscle or something. So they're super safe. We do not have to have goggles, but we can use them in open treatment settings. The science is there with our technology in getting deep tissue penetration with red light, infrared, and 905 nanometers. That's our core technology, utilizing those 3 wavelengths, pulsing and super pulsing to prevent thermal effects at the tissue surface so we don't overheat the tissue. Low-level laser therapy, photobiomodulation is a non-thermal process. We're not trying to warm up the tissue. What we're doing is we're trying to get light into the body.
So tell me this: what happens with lasers when it gets too warm on the skin? I'm not familiar with like anything when it comes to like treating body with lasers. So except, I mean, I understand red light therapy,
Right.
but you're talking about the lasers that you guys have are not designed to like heat the tissue up.
Right. All light produces heat, but the heat in our lasers is negligible. We don't want excessive heat at the tissue surface. Too much heat at the surface actually blocks that light from getting deeper into the body. I mean, if you think about it, our skin is a really great barrier. We don't get sunburned inside. So we have to use our technology to push photons of energy deep into the body. So we use pulsing, super pulsing. We have different frequencies. We have ranges of frequencies to prevent tissue accommodation and to prevent overheating at the surface. So like this device is 200 watts at the peak of the pulse. Now, I can't put 200 watts on somebody, right? But it's in nanosecond that laser is pulsed. So it's there for a billionth of a second and then it's gone. So by that pulsing, it prevents that buildup of heat. So that's one of the ways that we're able to get more photonic energy into the body where the mitochondria can utilize that.
So it's combining wave technology with light.
The wavelengths are the red, infrared, and 905. And then frequencies, how fast of the frequency that we're able to deliver that light. Higher frequencies, like 1,000 hertz or higher, have an inhibitory effect, and lower frequencies have a stimulatory effect. So we can treat different things based on frequencies.
So let's turn the clock back a little bit and tell people how you got into lasers in the first place.
Sure.
And then we'll talk a little bit about how you're integrating the laser systems into chiropractic.
Okay, certainly. Yeah, well, I've used chiropractic since I was in my 20s, and I was, let's see, I won't give away my age. In 2013, I was not able to play ultimate, my sport. I had such low back stiffness. Now I've had some, disc issues and stuff in the past. So it wasn't that, it was like a board. For 9 months, I couldn't bend over. I couldn't garden. I couldn't reach down to catch a disc if it was thrown low. So nothing was working. I do chiropractic, acupuncture, massage. No amount of stretching was releasing my back. So a girlfriend that I play ultimate with said to me, she's a physical therapist, she said it kind of under her breath. She said, Judy, why don't you try cold laser? I'm like, what is cold laser? I've never heard of this. And she said she had like mystery pain in her hip. Now, as a physical therapist, she couldn't figure it out, but she couldn't get rid of it. And she went to do cold laser, and she said it went away and it never came back. So I went online, found her provider, and it was $2,000. So I was like, well, I don't even know what this is. So I started searching, and I found a Groupon, 3 for $99. And so I went and was treated by this gentleman who actually turned out to be a laser wholesaler, basically. He sells all kinds of lasers. But in 3 weeks, he treated my back 3 times a week. And in 3 weeks, I'm back to gardening and playing my sport after 9 months, nothing working. So I was very intrigued by what this could do for my body.
Yeah, I think it's amazing when people find something that the aha moment, like, ooh, I can't do this anymore. What can I do to make me be able to do this again?
Yeah.
And then you get the aha moment.
Yeah, and I didn't have that expectation. I didn't know what it was. I wasn't sure it was going to work, but I was grateful.
And now I know that you've been working with the chiropractor, you said, a couple days a week. What has it been like to use the laser when people are having like acute subluxation and long-term entrenched like pain? Are you finding that it's helping people recover quicker?
With both. And with laser, the sooner you get in to be treated, the better. So if you roll your ankle or, an acute injury, the faster you get that laser on there, it's pretty remarkable how quickly it turns around. For chronic conditions, it's a slower go. So inflammation comes into the body over time and it leaves slowly, but you have to be persistent in asking it. You meet 3 times a week. You're diligent about getting that laser treatment 3 times a week for a couple of weeks, and you keep asking that inflammation to leave, and it does. It just takes. It's a different process.
Yeah, I think a lot of times people they just don't know. They hear the word laser and they're like, "Oh wow, it should be so powerful. It's just like one time type situation." But it sounds like it takes a while to be cumulative with the effect of laser treatment.
Yes, yeah. And with inflammation and chronic injuries, we didn't get there overnight, so it's not going to disappear overnight. We have a decade rule, so if someone's in their 40s, it's going to take about 4 treatments, but that's if they're healthy. Now, if they have, autoimmune disorders or compounding health behaviors, tobacco use, things like that, anything that slows down the healing process is going to mean that it's going to take longer, more treatments.
So I guess I'm curious now. What are some things that inhibit people's healing journey?
Diabetes,
Mhm.
slow down healing, people with diabetic wounds,
Cellular health,
cellular health, anything, blood flow, right? Poor circulation,
neuropathy.
neuropathy. I've treated peripheral neuropathy. That's one of my most favorite things to treat. It's really exciting. Tendinitis, soft tissue inflammation, muscle spasms, all kinds of things. We treated someone recently with a acute back. I mean, she was just wincing every move. She had a disc issue. And, 2 weeks out, she she responded with a 0 for pain yesterday. She got the chiropractic adjustments. We got the laser on her right away, and she's been diligent about coming in. And, now we're working a little bit more on her neck and shoulders because her low back is absolutely fine. We're continuing to get at the deep inflammation in there, but it's not really the source of pain right now. But we want to promote tissue repair, especially when you're feeling better. So people want to stop when they're out of pain.
Yeah, I honestly believe, when people get under care, like it is such a dependent upon the person's willingness to show up and
Yes.
the person's willingness to follow the directions that are given by the provider. I think a lot of times people want to do it their way
Mhm.
and they want to dictate their own policy and their own health, but that's why they ended up where they are.
Right.
And
Right.
it's hard for people to course correct when they get to that point where they want to be the decision maker, an adult, and like
Yeah.
it sometimes people just have to follow the protocol from a practitioner that says, "Hey, just do this."
Right. Right. And I tell people that, I commit to being here Monday, Wednesday, and Friday. Will you commit to this process? It's not going to be a one and done. It's lovely. And I have it often where people get some benefit in that first treatment and they're not expecting that. But I can't guarantee that. Sometimes it takes 3 to 4 treatments for them to really feel a difference.
So let's turn the questions back to you a little bit. I'm curious because I met you. You look super fit, super healthy. What are you doing to take care of yourself? And maybe some things you can share with our audience. Like, what does Judy do to stay healthy?
I love to ride my bike. I joke that I live at summer camp. I live on Tybee Island. It's a vacation island. So I can ride my bike on the beach. I can look at the stars. I do grounding. So making sure I get my feet on the earth. That's easy to do near the ocean. I play ultimate and I do, I'm very spiritual being. So I have a spiritual community that is, again, imperative to me for my health and wellness. My spiritual wellness totally impacts my physical health. I just like to play. I'm not disciplined at working out or doing anything like going for a run. That doesn't make sense to me, but make it fun, challenging, competitive. I'm in, and if it involves throwing plastic, I'm totally in.
So takeaways: ultimate frisbee,
Yeah.
getting yourself onto the beach, being close to the ocean, spiritual health.
Yeah.
Yeah, it's good stuff.
I really have learned to let go of the outcome. I have these instructions next to my mirror getting ready. Show up, be of service, shine. And if I had to add one more thing, it's let go of the outcome, because I'm not responsible for anything else. And it's not about me. I'm here to help alleviate suffering in the world. I know that I did that through mental health, and it wasn't me. It's just showing up and being present with people. And that's what this is about for me. Now it's physical health. This has helped me stay out of pain. And I just want to share that with others and have it more accessible and more known to people that they have this option.
Well, I really like the idea of how it can help people heal from inflammation.
Mhm.
And I think that there's a lot that when people, just in general, we're going to get, nicks and we're going to get sore.
Mhm.
Um, I like the idea that people can have a solution to, I hate it when people call chiropractic like an expensive Advil, but I think that when we think about laser paired up with chiropractic, there is a different level of healing.
Yeah.
And like I was saying earlier too, like if I have a misalignment of like a vertebrae or a rib and somebody like adjusts that back in, it doesn't always feel good.
Right. Right. And that's where the laser is so powerful, because that inflammation that's in there, yeah, it's everything is aligned. The chiropractor, I'm kudos to chiropractors. They've saved me so many times, but to get at that inflammation, to add this on, it accelerates the healing process. We know that. I leased a laser to someone who had a shoulder surgery recently, and we did pre-surgical protocols to prepare the body. And then I taught his wife how to do post, in case he was too banged up to to function after his shoulder surgery. But he's mostly been doing it himself daily. And the surgeon was astounded. He's weeks ahead of where they thought he would be. And they had to invent new protocols because his shoulder was so bad. And he only used opioids 2 days, and he didn't even want to do that, but they convinced him to do that. And they were shocked about that because it's a very painful surgery. So
You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is sponsored by Imaging Services, Chiro Health USA, Chiro Moguls, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, New Patients in a Box, the Influencer Authority Podcast Training, Mango Voice, Community Healthcare Resources, Life Chiropractic College West, TrackStat, and MSculpt. Let's hustle. Yeah, Bob Brooks, he used to say that the issue's in the tissues.
yes.
And I think that when people understand that, it's not pain, it's inflammation. And I've talked to so many like really high intelligent people recently about inflammation cycle and what we can do. But a lot of it's caused by the three T's: thoughts, traumas, and toxins, and physical, chemical, and emotional. And there's a lot of things that are leading to people to start getting inflammation. And when they don't feel good, they don't move.
Right.
And when they're not moving, it doesn't get function. And when things don't get function, that's when inflammation sets in and starts to like really be a problem for people. So I think it's interesting that you can help speed up on a cellular level,
Yes.
cellular level,
Yeah.
people's healing process.
Yeah, let me explain that a little bit in layman's terms. I'm not a scientist, but I do love the science just enough to get me in trouble. So what laser does is when our mitochondria respond to certain wavelengths of light, it makes sense that we respond to light, right? We produce vitamin D, we turn darker when we're out in the sun, put preemies under blue light to prevent jaundice. So we already know that our bodies respond to light. So within the cell, there are certain structures that are chromophores that respond to light, like photosynthesis for a plant. The mitochondria and cytochrome C oxidase respond to certain wavelengths of light in a therapeutic window, that red light, infrared, broadband, and 905. Those are all within that therapeutic window. And when they encounter those wavelengths, the mitochondria utilize cytochrome C oxidase to produce more ATP, adenosine triphosphate, which is fuel for the cell. The other thing it does is that laser, along with our static magnetic field, dissociates the bond between cytochrome C oxidase and nitric oxide. Nitric oxide is a vasodilator, so we can bring more oxygen in the microcapillaries, areas that get very little blood flow, white tissue like tendons, ligaments, bone, very little vascularity. So we can get oxygen into the cell and increase production of energy. The two things that cells need to do all of their numerous functions that I can't even begin to explain or understand is oxygen and energy. So during one brief light laser treatment, it's like filling up your cell's gas tank. You don't need to stop at the gas station on the way home or tomorrow morning. We know one laser treatment continues to have a benefit for about 48 hours. So the laser's not doing the healing, it's giving the cells the energy and oxygen, the supplies to do all of the things that it needs to do to repair the body more efficiently.
I love it because I love the idea about how somebody can be in need, and it's like watering a garden or getting sun onto a flower.
Yeah.
And that just happens to be our skin and our cells that need help.
Yes. And I love that you just brought up gardening and water, because I use this with our lasers to kind of describe how it works. Our class 1M is like a garden super watering system, very sophisticated watering system. So we can get that deep penetration into the soil. We even have one, and I'll do a product promo here, with a built-in laser stem with target and dose technology that measures impedance in the tissue and tells me where to treat and how long to dose. So if you had a sophisticated watering system for your garden that could measure the soil moisture and tell you when to stop watering, I mean, that's that. And now that we're adding a class 4, it's adding that fire hose, which we talked before the show about neuropathic pain, that entrenched pain that no longer has a source, but the cells, it hasn't stopped firing. The pain signals are still there. That's the fire hose. Sometimes you need a fire hose. So now we have that whole continuum of care. We have the fire hose and we have this sophisticated sprinkler system that really gets at the root of tissue repair, inflammation, that long-term healing. That's why we get such great outcomes.
I think it's a really important thing to discuss when people are thinking of different modalities to incorporate into their offices and to see people get better faster. You know, when I first got into chiropractic, you know, the doc I worked with, he was just always like, I want to help more people more efficiently.
Mm-hmm.
And we have to be like masters of our square footage in the small office. Like he's like, we have to do rehab over here, but we only get this much space. And this unit has to go here, and it has to be this much space. You have to put a chair there and a chair there. There has to be 4 chairs there. The waiting room isn't for waiting. It's for people to get a clipboard, and they shouldn't be there more than 10 minutes. And I think that when you're talking about like time of healing people, I was curious about that too. Is like, how long do you typically suggest somebody to get a treatment? And you're like, you know, you said that if somebody had different like areas to take care of, you'd have to consider time spent on a laser, but obviously you want to check people too. So let's just say, for instance, somebody comes in with tennis elbow. What's your protocol for them?
So treating tennis elbow, if there's no swelling, we would treat with 50 hertz for the itises, like tendonitis. Tendons are very tight tissue, highly reflective, and they take, once they're inflamed, they're slow to heal, but we keep asking. 50 hertz 3 times a week. It's just a few minutes. If I have the laser stim, that will pinpoint exactly where I need to treat. As a non-clinician, that is so helpful in identifying those areas, not just in the elbow, but then again in the wrist where those tendons connect. Treating the wrist is also very important. I've learned through the guidance with clinicians and clinical consultants and my doctor to treat the elbow and the wrist for something like tennis elbow or golfer's elbow. So it's really short for one area.
Yeah, I like how much information we're sharing today about the laser and healing. And I think that we should talk a little bit about maybe some people that have helped you along your journey to get where you are today. Some people that you might look up to, some people that might have influenced you on your health journey, or where, why you're so like integrated with the laser world.
Yeah. I mean, for me, there's so many people, I'm going to leave somebody out, but that have helped me. It is a village, right? It does take a village. I have mentors. I have worked with Andre Wright, the Wright Consult, to develop my website. I am an independent sales rep, but I also have my own business. I've been inspired by Daniel Tribby to put myself out there in front of the camera. Thank you, Daniel. Edgy entrepreneur. You should have him on the show if you haven't already. Just collaborating with all the beautiful beings that come into my life. I mean, meeting you at Life University at homecoming a couple weeks ago. It's really amazing who comes into my life right when I need them. And it's, I love Thich Nhat Hanh, some, I gather inspiration from Buddhism, from other spiritual communities. I'm very eclectic in that way. And I'm always learning, but it's sometimes from inconspicuous places that I get most of my grounding from, most of my life lessons.
So as you've been working in the chiropractic clinic and you've been working with people with laser, have you encountered any miracle stories where you've seen people's lives just change?
Yeah, absolutely. When I started working in chiropractic this year, I had a woman reach out to us who had a friend in Massachusetts who had peripheral neuropathy, and her friend told her about cold laser therapy and that it helped her neuropathy. So she found us, saw that we had laser on our website, and wanted to come in for laser. She already had a chiropractor, so we do an assessment, make sure she's appropriate for laser, and then I started to work with her. I consulted with our clinical team. I watched our webinar on treating peripheral neuropathy. I want to show up and do my best for this patient who is looking to us. And I've never treated it. I've seen it treated. I've heard about it. She had a case where she had surgery, low back surgery, and on her x-ray, she had 3, 1.5 inch screws in her back that were like this. And from that surgery, she lost feeling in her legs from her down. And some of it had come back, but her feet were completely numb. And from her knee down on the right side, her shin, no feeling. I could wiggle her toes. I could take a paper clip and poke her all the way to the leg, and she had no idea it was even touching her. It was she had to walk lifting her feet up because she didn't know where they were. So even though she didn't have feeling in her feet, her sensation was that she had sandpaper socks. She was so uncomfortable. She could only wear one pair of shoes. So she said her friend got better in 5 treatments. This patient was, I think, pushing 70. So the decade rule, I was thinking, well, let's do 7 to 10 treatments. And she said, no, I'm just going to do 5. So no pressure. But I'm like, okay, we'll start there. And if she starts to get benefit, we'll see if she'll sign up to get fully better. On her 4th treatment, she came in, took her shoes and socks off, and she starts rubbing her feet on the floor, gets all sassy, saying, I can feel the floor. And I'm like, wow, that's amazing. I said, what about those sandpaper socks? She's like, I don't have them anymore. Everyone in the waiting room coming in heard her story. Everyone on her way out, every doctor, every podiatrist that she was seeing heard her story. She regained feet. She did a squat for me. And over a couple more visits, she said, oh, you fixed what I came here for. I want you to work on this now. And sensation continued to come back over time. I saw her a couple months later for something else. I checked in. She's like, I have this weird feeling in my thigh, and I didn't realize it was numb, but I think I'm just getting feeling back there. So that, to me, if I do nothing else, what an amazing experience to help someone who for 3 years was told it won't get better.
Well, chiropractic philosophy is this, Judy. The power that made the body heals the body.
I believe it.
The body needs nothing extra in it, simply no interference. But as I've come to realize after 1,100 interviews in the past 5 years, those philosophical standards are true, but we're sicker than ever. People as a culture, population, not just the psychological traumas that we've all incurred over the past 3 years, but our food supply, our water supply, our air supply, the things that we think are healthy, we put on our skin, the things that we sleep on that we think are healthy for us. I mean, there's so many microtoxins around us, and it's chemical warfare on a day-to-day basis, depending on what you're doing. I mean, are you washing clothes? Or are you scrubbing floors? Or are you doing dishes? Or what are you doing? Are you pumping gas? Or are you in an airplane? There's so many times where our body's under different types of stressors, chemical, physical, emotional. And I think that people don't realize how much pain they store up in their body until it becomes an issue, and it becomes an episode in their life. And that's a lot of times why people start going to the chiropractor. They need somebody to give them a solution, an intervention. They need somebody to actually touch them and to do an exam of them. And that's one of the things that I really wholeheartedly believe in the chiropractic profession. But I do think that we're at a day and age where people are sicker than ever.
Yes. We're bombarded on a daily basis. We're bombarded with all kinds of toxins and pollutants, as you said, in our environment, what we put in our bodies. I do try to eat clean most of the time, but when I cheat, I realize I'm only cheating myself and adding to inflammation. So yeah, I think, having this tool is something that can help a lot of people. A lot of people are suffering. It's helped me tremendously. And, we change not when we see the light, but when we feel the heat. And unfortunately, that's what brings people to care. But I love that being in that caring role.
So let me ask you this. If people want to learn more about you and they wanted to work with you, where should we send them to?
Yes, coldlaserforpain.com.
Is that LASER?
LASER, all one word, no spaces. Cold Laser for Pain, FOR.
And at this juncture, is there anything that you wish I'd have asked you that I didn't ask you?
Yes, I wish you would have asked me about the Circle of Light retreat for women, exclusive women in chiropractic and bodywork, that I am collaborating with Tybee Wellness Retreats to offer for women to come together, be amongst their peers. There's going to be a sound bath. There's going to be tailored yoga, a nutritionist coming in. This is a place, and I will do complimentary laser all weekend on any body part for anyone that needs it or wants it. That's my gift back to this community. I want to grow our community of chiropractors with this healing modality that can help them and their patients. Help them. I treat so many chiropractors in these conferences that I know, give of their bodies. And that's part of the community I want to help heal as well.
Awesome. Well, thank you for sharing that too. And if you're down there in Tybee Island, check out this sound bath yoga nutrition laser retreat and get healthy. And what's the website for that?
If you go to Cold Laser for Pain upcoming events, there's a link to it.
All right, Judy. Well, thank you for being episode 449 of the Chiro Hustle podcast. There's a lot of great information we share with each other.
Thank you so much. I appreciate it, James.
Yeah. And thank you for being an advocate for the work that we do. And look forward to seeing you soon at another conference down the line.
I hope so. All right. Namaste.
All right. Bye for now.
Bye-bye.
Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.